Well, thank you for joining us. Appreciate your time. We're here in Teku, Ghana with a medical health fair. And doctor, if you could introduce yourself and tell us what your role is here at the health fair.
My name is Samuel Kofi Forson. I am a physician specialist, specialized and also public health specialist. I work in Takwa. I was invited, well, I've had this invitation for a long time to come and help the people out here. And we are so impressed about what we've seen, you know, the support the Church of Christ is giving to the people in the local community. One thing which impresses me most is the water, the clean water that they are having. Because in many parts of the rural areas in Ghana, I would say about 30% of the rural areas to 40%, they don't have this facility of water. And water is so important. It carries a lot of disease. And at the same time, if you are very careful of the water that you take, you kill a lot of the diseases without wasting much money and effort and human resources and so on. The diseases here are just similar to the disease pattern around Ghana, and for that matter in the tropics. There's a lot of malaria, there's a lot of gastroenteritis, diarrheas and vomiting, there's a lot of skin diseases. We've seen a very peculiar one I saw for so many years ago, but I was so impressed. But I will rush to say that it is not waterborne. It is. It looks like it's a childhood skin disease. We've seen some other skin diseases, tropical ulcers, boils, abscesses, and so on. Then if you come to the abdomen, you have seen. I mentioned gastroenteritis. We've seen people with enlarged liver, enlarged spleen. Which is quite common also in the rural areas. The other point is about the women. There's a lot of arthritis. In medical terms, called arthropathy. That's the waist pains, knee pains, and what have you. The other disease, which is now affecting people in the, I would say, in the rural areas, is hypertension. Hypertension, we've seen quite a few today, very bad ones, and diabetes. This used to be the preserve of the Western world, but now we are seeing it here, and I've seen some today here: diabetes, hypertension, migraine, and so on and so forth. What is that area? I'm here actually with Philomena Hemans. She is working at the government hospital. She's also come to assist us. The staff nurse midwife. Very good. It's a beautiful place. The greens around here, if one can actually get the basics of life, one should be able to have a healthy life, not a luxurious one, but a real, healthy, happy. You are very close to nature, you are very close to your creator, and you should be able to be happy in an environment like this.
Can you tell us briefly what medical care generally is available here, and what a clinic like today means to people here in Teku and the villages nearby?
But I think this locality is a bit poor from what I learned. Some health, I'll call it health clinic, what do you call this? Private clinics which are not well manned, and they don't have much resources. In fact, our coming here today, I think you will see the crowd which came today. You have people going to the dentist, the dental clinic, the eye, the ear, nose and throat, the blood. They even donated blood today, and of course general diseases, some of which I've mentioned earlier. The people are happy. A lot of them came because they need it. It's a felt need. You know, if one can have a good clinic, I don't say a highly sophisticated hospital, no, a good clinic taking care of tropical diseases and this basic hypertension, diabetes, and what have you, it will go a long way actually to make them live a very happy life.
Now, the people in Tennessee who help to support programs like this, What would you tell them in the future as they consider supporting efforts like the medical clinic today?
I think this is an area the people from Tennessee have really done well, and it's well appreciated. The people here are quite happy. They are quite happy about what you are doing, and they are praying that perhaps if you intend to, like Oliver Twist, to give them a good health center, not a hospital. I'm repeating this, with the basic facilities. What do I mean by basic facilities? An area for delivery, a general what do you call it, a clinic for seeing diseases which we mentioned, some of which we mentioned earlier, some laboratory, basic laboratory. X-ray may be too expensive, but if you will be generous enough to add X-ray, it will go a long way so that they don't have to travel. The questions I asked from those who came to see me is that they go as far as Praso or Takwa, or one said Takwa, Praso, and which is the other place? Bogoso. Yeah, but Bogoso still is Takwa and Praso, which are about the nearest. And of course, Cape Coast, that's a far off place.
And how far are all those places?
Now, in case of Takwa, I would say it's about an hour's drive. No, from to Takwa. To Takwa.
Okay.
That's about, it should be around
More than
60 kilometers. Well, I came with a four,
And most people,
right.
and most people here,
And the road is poor.
they lack transportation, and the roads are
You
troubled.
lack transportation. The road is poor. If you are, I don't know very much. It's a long time of the road to Praso, but many of them point to Praso, which will take you another 1 hour to get there. But really, I think they all look towards going to Takwa. If we get this year, very few cases will go to Takwa, and the only few cases will be those who will have the fullest benefit of healthcare. Because if we are able to do this, I think Tennessee, the Tennessee will have a very what do you call it, a very fine reception, and perhaps we'll invite the leaders of Rotary to come here one of these days to see the good roads that they have left. We've met some of your citizens, and they are so nice. So we interacted to them. We are so happy to have them here. So we pray God that it opens your arms to support them financially. I'm sure the human resource we can get them from our local resources. With that, I'm sure we should be able to help them. Now they have water supply. They have some form of communications with their health care being taken care of. And of course, I think the church too is supporting them in their farming activities. They have enough food. What do you want in this world again? You know, with this, we'll thank our Tennessee friends and of course the good God who created all of us. Thank you.
Thank you so much.
Yes, thank you.